The 2008 Occupational Therapy Assistance class of Lone Star College-Kingwood would like to welcome you to view our video titled How to Transfer. To sit the client on the edge of the bed, first have them flex their opposite knee to the therapist. Ask them to push with their foot and reach with their arm. Bring the client's feet off the edge of bed and shift the client's body to an upright position. To scoot the client to the edge of the bed, shift the client's weight and position your hand behind the opposite buttocks as you guide the client forward. Move the client forward until their feet are flat on the floor. To don the robe, the client's feet need to be flat on the floor. Their feet should be bare or have on non-skid shoes. The therapist is within arm's reach for safety, support, and supervision if necessary. Allow the client to do as much as possible in donning her robe. The gait belt should be placed around the client's waist prior to transfer. It should be tight, but allow the therapist's hands to fit under for grasping. The belt is guided first through the teeth of the buckle, then through the other side of the buckle. The long end of the belt should be tucked in. If the client has a peg tube, the belt can be placed under the client's arms. For a stand pivot bed to wheelchair transfer, the wheelchair is locked and placed at a 30-degree angle to the bed. The client's ankles should be pointed toward the surface to which the client is transferring. The therapist should stabilize the client's affected foot and knee by placing her legs on either side. With arms around the client's waist and hands holding the gait belt, on a count of 3, the client is guided to the wheelchair and gently helped to a sitting position. To scoot the client back in the chair, the client's weight is shifted and the therapist guides the opposite buttocks backwards until the hips are touching the seat. The pivot transfer is used when the client cannot initiate or maintain a standing position. The therapist should stabilize the client's feet and knees by placing her feet laterally around the client's. On the count of 3, the client is guided to the wheelchair and placed in a sitting position. A 2-man lift can be utilized to scoot the client back in the chair. For a 1-person dependent sliding board transfer, the wheelchair is locked at 30 degrees to the bed with the armrest to the bed removed. Place the sliding board under the client's thigh, midway between the buttocks and the knee, to form a bridge from the bed to the wheelchair. The sliding board is angled toward the client's opposite hip. Stabilize the client's feet and knees by placing your own feet and knees laterally around the client's. Help the client lean over the knees by pulling her forward from the shoulders. Reach under the client's outside arm and grasp the gait belt. On the other side, reach over the client's back and grasp the gait belt. Gently rock the client to a count of 3. Pivot the client onto the sliding board and into the seat. With an independent sliding board transfer, The client positions the board mid-thigh. The client transfers her upper body weight in the direction opposite to which she is going. The client uses both arms to slide along the board to the chair. Oftentimes, a client may need to be transferred to a gurney so that they can be transported for test. The draw sheet transfer can be utilized to do this if 3 to 4 people are available for the transfer. First, the client needs to be rolled for the sheet to be placed underneath them. The gurney is brought to position. The edges of the sheet are rolled and the therapist grasps the sheet with hands supinated. With arms braced and on a count of 3, the client is moved halfway towards the gurney. The therapist then reposition themselves and move the client the remaining distance. To don the diaper, the client is rolled to one side. The diaper is rolled and positioned correctly under the client. The correct positioning will save a lot of time and effort that would have to be repeated if placed incorrectly. Time for readjustment is fine. However, if multiple rolls are required, it is an excellent time to have the client assist in bed mobility. The client is then rolled to the other side so the diaper can be straightened. The diaper is then pulled between the legs and fastened on each side. Thank you for viewing our Lone Star College-Kingwood video on how to transfer from the Occupational Therapy Assistant class of 2008.